sluggish start to the pandemic that infected most parts of the world, Russia's COVID-19 caseload is suddenly soaring. Russia's President Vladimir Putin has tasked government and regional administrators with increasing testing amongst Russians. With more than 270,000 cases, Russia is currently in the second place in the world. And Moscow, the capital, is the country's worst affected city. Authorities say their strategy is mass screening of the population.
Большее количество людей будет проверено на наличие возбудителя, тем будет проще остановить эпидемию, тем будет меньше потерь в экономике страны, тем больше будет возможность предпринять необходимые меры.
Some Russian laboratories are conducting 9,000 tests a day and offering results within 3 days.
Мы используем систему «Вектор», разработанную новосибирскими учеными, и ее точность, точнее сказать, диагностическая чувствительность и диагностическая специфичность, так же как у ПЦР-исследований в любых других странах, абсолютно сопоставимы и находятся на очень высоком уровне. Это больше 98%.
Все просто. Мы используем специфический метод, который позволяет обнаруживать непосредственно сам генный материал вируса. Он позволяет его находить очень быстро, этот метод, в течение 30 минут с момента забора до, собственно, результата, и позволяет определить визуально, просто прошла реакция или нет, соответственно, визуально понять, есть ли в образце вирус или его нет.
Over the last week, Russia surpassed the United Kingdom as having the third highest number of confirmed diagnoses of the novel pathogen. The world's largest country geographically now has the second fastest rate of new infections worldwide. In 4 weeks, it went from occupying the 20th spot in the world in terms of new infections to the second spot. And now we have our correspondent from Moscow, Lucy Taylor, joining us live on the broadcast. Russia's cases are soaring. Lucy, talk to us about the government's contingency plan here to tackle these cases, even as Russia has reported less than 9,000 cases in a single day for the first time in many days.
That's right. This is the lowest daily rise since May the 1st. It's still a fair number of new cases, just almost 9,000, and it takes the overall tally to 290,000 confirmed cases. As you said, that's now the second largest outbreak in the world. They say that this is partly down to the widespread testing that they've been doing. There are now 7 million tests which have been carried out in Russia to try to determine who has the virus, and there's also a widespread antibody testing program being introduced in Moscow. That started on Friday, taking 70,000 people chosen at random every few days to try to determine who's already had the virus rather than who has it right now, to try to get to what is the real situation, who has had it, how many people have had it, therefore when can restrictions be eased. We've heard today from the Prime Minister, Mikhail Mishustin, who himself was diagnosed with coronavirus in April. He seems to be back at work now. He appeared in a televised video conference with other members of the government. He said that 27 regions of Russia have now seen a slowdown in cases, and to the extent that they're able to ease restrictions. He didn't say which 27 regions those were. This is a very big country, so it stands to reason that the outbreak will be at different stages across the country. Here in Moscow, though, it is still fairly difficult situation. Yes, there have been new rises in cases. There was a record number of daily deaths on Saturday, so not out the woods yet at all. But we are told that the situation across the country is stable, that the outbreak is under control, and that the cases will now continue to go down.
Lucy, there's also talk of how authorities in Russia's key strategy going forward would be mass screening of the people, especially in Moscow, the capital, which is the epicenter of the outbreak in Russia.
Yes, so this is this program which began on Friday. It was announced by the Moscow mayor, Sergei Sobyanin, who urged Muscovites, if they received the invitation to get this test, to go and have the testing program. It's a blood test as well as a nasal swab. It will look for antibodies in the blood to try to find out whether people have already had the virus. Moscow's mayor said that he believes the number of people who have or have had the virus is 3 times higher than the official figures show, because so many people are asymptomatic or had less severe versions of the virus that they haven't sought medical help in the past. So people will receive an email, they'll receive an SMS telling them that they can go to get this test at a clinic and be told whether they themselves have had the virus, perhaps without knowing it. There are other measures in Moscow as well that have been brought in. People have been told they have to wear a mask and gloves in shops, on public transport, to try to stop them spreading the virus elsewhere. Technically, this capital, Moscow, is still in partial lockdown. People are still being told to stay at home, not to go out for exercise, only to go out for other personal journeys if they absolutely have to, and to still get a digital pass on their phone if they travel by car or public transport in case they're stopped by police. We know, though, from the web company Yandex, which is monitoring activity in Moscow, that many more people are on the streets than they have been in previous weeks. So although the city is still in lockdown, all these messages from the government that the outbreak is under control, that the growth in cases are slowing, they are bringing people back out onto the streets, taking people back to work. So it'll be interesting and important to see over the next few days, over the next few weeks, if the cases continue to slow down in growth, or whether we may see more cases now that people feel more comfortable about going out and about onto the streets.
Our correspondent from Moscow, Lucy Taylor, joining us with that live ground report. Thank you, Lucy, for being with us here on WION Fineprint.